Hey everybody, so welcome back to another episode of our Daily Doc Talk here. One of the things that I wanted to kind of express today and talk about was the my approach with my ultrasound guided techniques. And so I was traditionally trained in palpation based prolotherapy before I got introduced to ultrasound. And I personally believe, and I'm biased because I that's how I was trained, but I do personally believe when I look at other docs out there who were just trained initially in ultrasound or fluoroscopy and didn't have the palpation base beforehand, that I think there's a little bit that's missing when we're looking at the comprehensive prolotherapy world, which is making sure that we're basically doing these spot welds around the different entheses. So, which is the enthesis, for those who don't know, is where ligaments and tendon attach on a bone. And so I think that the being able to do a good palpation based approach using that thumb to find where there's pain generators, where tissues are. I can palpate where the MCL is attaching onto the bone. I can also image it under ultrasound, and I think there's benefit to being able to do both of those. However, in some situations, the ultrasound is definitely going to win over palpation based. A great example outside the spine, because we're going to just full on for the spine, it's imaging, but is the hip joint. So the hip joint, the current literature shows that if you're doing what's called a palpation based, or some will call it blind because there's no true imaging associated with it. But if you're doing a palpation based, meaning you're not using ultrasound or x-ray, it's about a 50 to 60% chance that the solution is actually getting inside the joint when the physician thinks it's in the joint. And so that's based off what the physician feels. But even when they do studies where they do the injection, the doc goes, okay, I think I'm in the joint, and then they check with either ultrasound or it's usually fluoro that they're checking with, which is x-ray, it's still only about 50 to 60% of the time that they're actually inside the joint. And so the hip joint is one that I am a firm believer, should always be done under ultrasound guidance or fluoroscopy, because that's how you get near 100% accuracy in actually getting inside of a joint. Some other structures, for example, like where the ATFL, the anterior talofibular ligament, which is the most commonly injured ligament in the body, specifically in the foot, but in the entire body, it's really easy to palpate where that is and pepper that area, which is basically doing small injections with Prolo or whatever we're doing. However, so that's not one that absolutely should be done under ultrasound guidance. And sometimes there's a benefit if there's a full or a partial thickness tear in that ligament, as an example. Then I, as a provider, want to make sure I'm going in and doing a deeper or a more accurate injection into that actual tear. But if you just have some ligament laxity from rolling your ankle a lot and there's no major tears in that ligament, just doing a palpation-based approach to that ligament can be very, very, very effective. It tends to be much quicker to do the injection. It's more cost-effective for patients. And so I firmly believe that the best approach is to use a combination of all three based on what's happening and based on the different areas that's being treated and all that kind of stuff, whether it's spinal or it's going for the knee joint and you're doing some superficial things around the knee or even in the ankle and things like that. So just something to think about if you have been working with someone who isn't using image guidance and you haven't been seeing major improvements. That's one thing to consider, that maybe you do need to work with a provider who can do some form of image guidance for your injections. So that way they're able to make sure that they're getting into the correct space. They're getting into the correct joint. They're actually getting the enthesis of that tendon or ligament. And then again, if you go through all of that and you're still not getting any improvements or barely any improvements, typically means that you need to find a provider who can do a more thorough physical exam in order to actually elicit your tissue pain generators and figure out what is going on in that area. And understanding that sometimes we can have atypical presentations of pain on things that appear to be one thing and they're actually not. I currently have 2 patients right now who we haven't seen much improvement after. Excuse me, I'm gonna sneeze. Not gonna happen. Haven't seen much improvements after we did some musculoskeletal treatment, so some perineural or some prolotherapy, and we decided to, because it kind of fit with a few other things, actually treat with an antiviral because we think this might be an atypical presentation of shingles, of varicella zoster. There was no rash, nothing like that. But both of these patients are starting to see some pretty significant improvement when nothing in the past was working. Most of these cases are going to be spinal cases where we're seeing the varicella, potentially varicella zoster, and treating with either acyclovir or I'm losing my words here, valacyclovir or femcyclovir. But again, so that's also something else to consider, that if you have been going and you're pretty confident that the doctor's confident in their diagnosis, but you haven't, like, there's something else missing, and you're not getting positive response, it might be something that is more systemic and not necessarily directly local that needs to be treated with a needle. I'm rambling at this point, so but I'm super stoked because my wife and I are going to Seven Lions tonight in Glitch Mob, so that'll be fun. Definitely gonna be way past our bedtime, so that'll be always fun too. But I hope you guys had a wicked awesome weekend, and you enjoyed your Sunday evening, and you are excited for the week ahead. And remember, if you hate your job and it causes you a lot of stress, it might be a good idea to reevaluate why you're in that job and if you should do something different about it. All right, see you later, everybody.